Every time you open your mouth, your body is showing you information that most people never think to look at. Information that traditional medicine has used for thousands of years and that modern clinical research is now validating with increasing specificity. Information that is visible, free to examine, and available to you every single morning in your bathroom mirror. Your tongue. The tongue is one of the most diagnostically rich surfaces in the human body. It is supplied by multiple cranial nerves, receives blood from branches of the carotid arteries, is covered by specialized tissue that reflects the health of the digestive system, the immune system, and the cardiovascular system simultaneously, and changes in visible, identifiable ways in response to nutritional deficiencies, systemic diseases, medication effects, and circulation problems, often before those conditions are detected by standard blood tests. Today, I'm going to walk you through 8 specific tongue findings, each one visible with nothing more than a mirror and good lighting, that have clinical significance for adults over 60. What each finding looks like, what it may be signaling about your systemic health, and what to do about each one. By the end of this video, you will look at your tongue differently every morning. And in some cases, what you see may prompt a conversation with your doctor that turns out to matter considerably. I am Dr. Wells, and this is WellAge Health, honest, evidence-based health information for adults over 55 every single week. Before we begin, tongue findings are clinical signs, not diagnoses. A single finding on your tongue does not confirm a specific condition. What it does is provide a signal worth investigating in context, alongside your symptoms, your medical history, and your doctor's evaluation. Nothing in this video should replace a clinical assessment. Use it as a reason to look more closely and to ask more specific questions. Let's start with what a healthy tongue actually looks like, because knowing the baseline makes every deviation from it meaningful. A healthy tongue in an adult is pink, not bright red, not pale, not white, not purple. It is uniformly pink with a slight variation in shade between the tip, the sides, and the back. The surface is covered with small projections called papillae, particularly the filiform papillae, which give the tongue its slightly textured appearance, and the larger fungiform papillae, which are the small raised dots distributed across the surface that contain your taste buds. The coating on a healthy tongue is thin, white to clear, and evenly distributed. It is moist. The tongue is not swollen, not scalloped at the edges, not cracked in the center, and not smooth where texture should be present. Any consistent deviation from this baseline that persists across multiple days and is not explained by the food you ate last night or a medication you recently started is worth examining more carefully. The first tongue finding is a pale tongue, and this one is clinically significant enough that physicians in multiple specialties are trained to look for it. A pale tongue, one that is noticeably lighter than the normal pink, appearing almost white or very light pink at the surface, is one of the clinical signs associated with anemia, specifically iron deficiency anemia, which is the most common nutritional deficiency globally and is more prevalent in adults over 60 than in younger adults for several reasons. After 60, iron absorption from the gut declines partly because of reduced stomach acid production, and because stomach acid is necessary to convert dietary iron from its ferric form to its ferrous form, which is the form that can be absorbed. Adults taking proton pump inhibitors for acid reflux, one of the most commonly prescribed medication classes in older adults, further reduce their stomach acid and therefore their iron absorption capacity. Additionally, chronic use of non-steroidal anti-inflammatory medications can cause microscopic gastrointestinal bleeding that slowly depletes iron stores over months without producing any noticeable digestive symptoms. A pale tongue accompanied by fatigue, shortness of breath on exertion, cold hands and feet, or brittle nails is a combination that warrants a blood test, including a complete blood count and ferritin level. Ferritin being the storage form of iron and a more sensitive indicator of iron status than hemoglobin alone. Many adults with iron deficiency discover it only when their hemoglobin has already fallen significantly, by which point months of suboptimal tissue oxygenation have already occurred. The second finding is a bright red tongue, and the shade and pattern of redness matters considerably. A uniformly bright red tongue, sometimes described as a strawberry tongue or a beefy red tongue, that persists across several days and is not explained by recent consumption of red-colored foods, is associated with vitamin B12 deficiency. B12 deficiency produces changes in the tongue called atrophic glossitis, a progressive loss of the papillae that normally cover the tongue surface. As the papillae atrophy, the tongue surface becomes smoother and the underlying tissue, which is highly vascularized, becomes more visible, producing the bright red, smooth appearance. B12 deficiency is disproportionately common in adults over 60 for several reasons. The absorption of B12 from food requires a protein called intrinsic factor produced by the stomach. With age, the gastric cells that produce intrinsic factor decline. A condition called atrophic gastritis affects approximately 30% of adults over 60 to some degree. Long-term use of metformin, one of the most commonly prescribed diabetes medications, is associated with significantly reduced B12 absorption. And adults who take proton pump inhibitors long-term experience reduced B12 absorption because the acid environment of the stomach is necessary to release B12 from food proteins. B12 deficiency has neurological consequences that are severe and can be irreversible if deficiency is sustained over years. Peripheral neuropathy, numbness, tingling and weakness in the hands and feet, cognitive decline, balance problems and depression are all documented neurological manifestations of B12 deficiency. The tragedy is that early B12 deficiency is easily diagnosed with a blood test and highly reversible with supplementation. But it is frequently overlooked because the fatigue and cognitive symptoms it produces are attributed to normal aging rather than to a correctable nutritional deficit. If your tongue has become noticeably smoother and brighter red over recent months, particularly if you are on metformin, a PPI, or have not eaten animal products regularly, a B12 and folate blood level is a priority conversation to have with your doctor. The third finding is a white coating, and this requires careful distinction because not all white coatings on the tongue are clinically equivalent. A thin, uniform white coating on the tongue, particularly in the morning before eating or drinking, is normal. It represents the accumulation of dead cells, bacteria, and food debris that collects overnight when saliva production is at its lowest. This coating clears after eating, drinking water, or gentle tongue cleaning and has no clinical significance. A thick white coating that does not clear with eating and drinking, or that has a patchy, irregular distribution, particularly if it is accompanied by a burning sensation or altered taste, may represent oral candidiasis, commonly called oral thrush. Oral candidiasis is a fungal infection caused by Candida albicans, and it is more common in adults over 60 for several specific reasons. Dry mouth, xerostomia, reduces the antimicrobial properties of saliva, creating an environment favorable for Candida overgrowth. Inhaled corticosteroids used for asthma or COPD can deposit in the oral cavity and suppress local immune function, predisposing to oral candida. Poorly fitting dentures provide a surface for biofilm formation, and systemic conditions, including diabetes, particularly when blood sugar is poorly controlled, significantly increase oral candida risk. Oral candidiasis is usually treatable with antifungal medication, but its presence in an adult over 60 without an obvious precipitating cause. Recent antibiotics, inhaled steroids, denture issues is sometimes a signal of impaired immune function or uncontrolled blood sugar that warrants investigation. If you develop a thick white coating with burning that does not resolve in 2 to 3 days, see your doctor or dentist. A specific variant of white tongue finding that requires immediate professional evaluation is called leukoplakia, thick white patches that cannot be wiped off. Leukoplakia is caused by abnormal cell growth in the mucosal lining and is considered a potentially premalignant condition, meaning it can be a precursor to oral cancer. The risk of oral cancer increases with age, and leukoplakia, particularly when it appears on the side of the tongue or on the floor of the mouth, should always be evaluated promptly by a dentist or oral medicine specialist. This is not a watch and wait situation. Any white patch that cannot be wiped off and has been present for more than 2 weeks deserves professional assessment. The fourth finding is a geographic tongue, and this is one that many adults over 60 discover accidentally and find alarming, so it deserves clear explanation. Geographic tongue, also called benign migratory glossitis, appears as smooth red patches surrounded by slightly raised white or yellow borders on the tongue surface, giving it a map-like appearance. The patches change location over days to weeks, which is why it is called migratory. It is entirely benign. It is not infectious. It is not a sign of systemic disease in the vast majority of cases. It is caused by an inflammatory process in the tongue mucosa that is not fully understood but appears to involve immune system hyperreactivity. Geographic tongue affects approximately 2% of adults and is more common in people with psoriasis and other inflammatory conditions. It can cause mild sensitivity to spicy or acidic foods. It requires no treatment and carries no malignant potential. If you have geographic tongue, you do not need to be concerned, but you should mention it to your dentist at your next visit to confirm the diagnosis, because the appearance can occasionally be confused with other conditions that do warrant investigation. The fifth finding is a purple or bluish tongue, and this one is the most directly cardiovascular in its implications. A normally pink tongue that has taken on a distinctly purple or bluish tint, particularly on the undersurface of the tongue, where the veins are most visible, can be a sign of inadequate oxygenation of the blood or compromised circulation. Medically, this coloration is called cyanosis, and when it appears in the tongue and oral mucosa, it is called central cyanosis, meaning it reflects the oxygen saturation of the blood reaching the central circulation rather than a local circulation problem in a specific limb. Central cyanosis in an adult over 60 can indicate heart failure with reduced ejection fraction, severe COPD, or respiratory compromise, or other conditions that reduce the oxygen-carrying capacity of the blood. It is a finding that warrants prompt medical evaluation, not monitoring at home. A distinction worth making: some adults have naturally darker pigmentation on the tongue surface and oral mucosa, which is a normal racial and ethnic variation and has no clinical significance. What I am describing is a change in color that represents a departure from that individual's normal baseline, a tongue that was previously pink and has become noticeably purple or blue. If you notice this change, particularly if it is accompanied by shortness of breath, reduced exercise tolerance, or fatigue, contact your doctor promptly. The sixth finding is a swollen or scalloped tongue, and this one carries several potential meanings that are worth distinguishing. A tongue that appears enlarged, filling the mouth and showing the impressions of the teeth on its sides, creating a scalloped or crenated edge, is associated with hypothyroidism, nutritional deficiencies, including B vitamins and iron, and in some cases with sleep apnea. In hypothyroidism, underactive thyroid, reduced thyroid hormone levels cause tissue changes throughout the body, including in the tongue. The tongue can enlarge and become slow-moving, contributing to slurred speech and difficulty swallowing in more significant cases. Hypothyroidism is significantly more common in adults over 60 than in younger adults, and its symptoms, fatigue, cold intolerance, weight gain, constipation, slowed thinking, are frequently attributed to normal aging rather than investigated as potential thyroid dysfunction. The scalloped tongue is one of several physical findings that, seen together, prompt a thyroid function test. The connection between scalloped tongue and sleep apnea is more mechanical. An enlarged tongue contributes to upper airway obstruction during sleep. The tongue falls backward during sleep and partially blocks the airway. If you have a noticeably enlarged scalloped tongue and you snore heavily or wake unrefreshed, mentioning the tongue finding to your doctor alongside your sleep symptoms strengthens the case for a sleep study evaluation. The seventh finding is a deeply fissured or cracked tongue, and again, the distinction between a normal variant and a clinically significant finding matters. Fissured tongue, a tongue with multiple grooves, cracks, or fissures across the surface, affects approximately 5% of adults and is largely a benign anatomical variant with a genetic component. If you have had a fissured tongue your whole life, it is almost certainly normal for you. What changes the clinical picture is when fissuring develops or worsens in an adult over 60 who did not have a significantly fissured tongue in younger decades. New or worsening fissuring can be associated with dry mouth, xerostomia, which is extraordinarily common in older adults. Approximately 30% of adults over 65 experience clinically significant dry mouth, primarily as a side effect of medications. Over 500 medications list dry mouth as a side effect, including many antihypertensives, antidepressants, antihistamines, bladder medications, and diuretics. Dry mouth is not merely uncomfortable, it removes the antimicrobial and lubricating protection that saliva provides, increasing risk of dental decay, gum disease, and oral infections. If your tongue is developing new fissuring and you are experiencing dry mouth, a medication review with your doctor or pharmacist to identify which of your medications are contributing and whether any can be adjusted is a practical and often productive step. The eighth finding is a black, hairy tongue, and while its appearance is startling, its cause is almost always benign and correctable. Black hairy tongue occurs when the filiform papillae, the normal projections on the tongue surface, become elongated and discolored, typically due to a disruption in the normal oral microbiome. The elongated papillae trap pigment from food, coffee, tea, or tobacco, and from the overgrowth of chromogenic bacteria that produce dark pigments. The result is a tongue surface that appears black, brown, or dark green and has a fur-like texture. The most common triggers in adults over 60 are recent antibiotic use, which disrupts the oral microbiome, poor oral hygiene, heavy coffee or tea consumption, tobacco use, and dry mouth. It can also occur in adults on certain medications, including bismuth compounds and some psychiatric medications. Black hairy tongue is not dangerous, not infectious, and resolves with improved oral hygiene, gentle tongue brushing twice daily, adequate hydration, and elimination of the triggering factor. If it does not resolve within 2 weeks of improved hygiene and removal of the suspected trigger, see your dentist to confirm the diagnosis. Now, let me bring this all together with a practical morning habit that takes 60 seconds and could, over time, give you early signals worth acting on. Every morning, after waking and before eating or drinking, go to the mirror in good lighting and briefly examine your tongue. Extend it fully. Look at the color. Is it the normal pink, or is it pale, red, purple, or darkened? Look at the coating. Is it thin and clear, or thick and white with patches that don't clear? Look at the surface. Does it have normal texture and papillae, or is it smooth where it was not smooth before? Look at the edges. Are they scalloped or indented? Look at the center. Are there new cracks or fissures? Check the underside. Are the veins a normal blue, or have they darkened significantly? This observation takes 60 seconds. It costs nothing. And if you notice a change that persists across 5 or more consecutive days, something that is different from your established normal, bring it to your doctor or dentist's attention with a specific description of what you see and how long you have noticed it. You do not need to diagnose yourself. You need to notice and report. The clinical evaluation that follows a well-described tongue finding often leads somewhere useful. A blood test that reveals a correctable deficiency, a medication review that identifies a contributing drug, a thyroid panel that catches hypothyroidism years before it would have been otherwise detected, a sleep study that diagnoses apnea that has been disrupting health for years. Your body communicates constantly. The tongue is one of its most accessible and most informative channels. Most adults over 60 never look at it deliberately. Starting tomorrow morning, look. Thank you for watching. Please subscribe. I cover topics exactly like this every single week. Leave a comment and tell me whether you have ever noticed anything unusual about your tongue and what you did about it. I read every single comment, and your experience might be exactly what someone else in this community needs to hear.